Bismillahirrahmanirrahim. Rabbi zidni ilma. It's fine to celebrate success, but it is more important to heed the lessons of failure. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq, and under the supervision of Professor Dr. Sara Afzal, today my topic of presentation is syphilis. Learning outlines include the introduction, epidemiological triad, chain of transmission, clinical features, levels of prevention, recent advances, and multiple choice questions. Learning outcome. At the end of this presentation, participants would be able to describe syphilis, its epidemiological triad, stages, and levels of prevention. So starting with syphilis, introduction. It is a sexually transmitted infection that can cause serious health problems without treatment. Infection develop in stages which are primary, secondary, latent, and tertiary. Each stage can have different signs and symptoms. Syphilis increases the risk of both transmitting and getting infected with HIV. Do HIV testing in all patients with syphilis. Spread of syphilis. One can get syphilis by direct contact with a syphilis sore during vaginal, anal, or oral sex. Syphilis can spread from a mother with syphilis to her unborn baby. One cannot get syphilis through casual contacts with objects such as toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, sharing clothes, or eating utensils. Risk for syphilis are in gays or bisexual men, HIV positive persons, those taking pre-exposure prophylaxis for HIV prevention, partners who have tested positive for syphilis, and all pregnant women should receive syphilis testing at their first prenatal visits. Epidemiological triad includes the agent, host, and environment. Starting with the agent. Treponema pallidum is a spirochete bacterium with various subspecies that causes the disease syphilis, gall, and yaws. It is transmitted only amongst humans. So the properties of the Treponema pallidum are: it is a small spirochete measuring 6 to 15.2 micrometers. It has 6 to 12 coils, not seen by light microscopy, best seen with dark field microscopy. It has bending and rotating motility. There is no culture may survive in blood. As you can see, it is gram-negative, obligate parasite. It is spirochete. It has endoflagellum, has protein which leads to a spiral shape. Host. Only known natural host is the human. Transmission. Syphilis is transmitted from person to person by direct contact with a syphilitic sore known as Shankari. It is transmissible by unprotected sex with multiple partners, men having sex with men, mother to child transmission, and in HIV positive patients. Incubation period. The average time between acquisition of syphilis and the start of a symptom is 21 days, but can range from 10 to 90 days. Sign and symptoms. There are 4 stages of syphilis, which are primary, secondary, latent, and tertiary. Each stage has different signs and symptoms. Starting with the primary stage, Shankari. During the first primary stage of syphilis, one may notice a single sore or multiple sore. The sore is the location where syphilis entered in the body. These sores usually occur on or around the penis, vagina, anus, rectum, lips, or in the mouth. Sores are usually but not always firm, round, and painless. Because the sore is painless, one may not notice it. The sore lasts for 3 to 6 weeks and heals regardless of treatment. Even after the sore goes away, one must still receive treatment. This will stop infection from moving to the secondary stage. You can say this sore. Secondary stage. It is seen 6 weeks to 6 months after primary Shankari. Usually diffuse, non-pruritic, indurated rash, including palms and sores, look rough, red, or reddish brown. Other symptoms may include fever, swollen lymph nodes, sore throat, patchy hair loss, headaches, weight loss, muscle aches, and fatigue. The symptoms from this stage will go away with treatment. Without treatment, infection will move to the latent and possibly tertiary stage of syphilis. Latent stage. The latent stage of syphilis is a period when there are no visible signs or symptoms. Without treatment, one can continue to have syphilis in body for years. Tertiary stage. Most people with untreated syphilis do not develop tertiary syphilis. However, when it does happen, it can affect many different organ systems. These include the heart and blood vessel and the brain and nervous system. Tertiary syphilis is a very serious and would occur 10 to 30 years after the infection began. In tertiary syphilis, the disease damages internal organs and can result in death. A healthcare provider can usually diagnose tertiary syphilis with the help of multiple tests. Neurosyphilis, ocular syphilis, and autosyphilis. Without treatment, syphilis can spread to the brain and the nervous system, to the eyes and the ear. This can happen during any of the stages described above. Signs and symptoms of the neurosyphilis can include severe headache, muscle weakness, or and trouble with muscle movements, and changes in mental state and or dementia. Signs and symptoms of ocular syphilis can include eye pain and or redness and changes in vision or even blindness. Signs and symptoms of autosyphilis may include hearing loss, ringing, buzzing, roaring, or hissing the air, which is called tinnitus, and dizziness or vertigo. Late benign syphilis, the gumma. The gumma is the most common complication of late syphilis. Gummas may be single or multiple, start as a superficial nodule or as deeper lesion that break down to form punched out ulcers. They are ordinarily indolent, slowly progressive, and indurated granulomata with central healing with an atrophic scar surrounded by hyperpigmented borders. May be destructive, but responds rapidly to treatment, thus is relatively benign. As you can see, the presence of gumma on the finger, on the forehead, and on the ankle of the foot. So these are the different stages of syphilis, which is the primary, Shankari lesion, then the secondary, then the latent, and latent is early latent or late latent, and then the last, which is called late or tertiary, gumma. Moving towards the congenital syphilis. Congenital syphilis is transmitted in utero after the first 16 weeks of pregnancy. Therefore, it is usually not a cause of abortion during the first trimester. This is very important to remember. It leads to second trimester onwards abortions and miscarriages. It has been divided according to arbitrary division line of 2 years into early and late types. The early congenital syphilis is the features are similar to secondary syphilis. Usually, it occurs 2 to 8 weeks after birth, presenting with failure to thrive, mucocutaneous lesions, which is called condylometalata, generalized lymphadenopathy, nasal snuffles, and skin rashes. Late congenital syphilis. The onset usually occur at or near puberty. Well-known stigmata includes nerve deafness, interstitial keratitis, and Hutchins disease. Because it is called Hutchins triad, all three features are included. Eighth nerve deafness is present, interstitial keratitis, and Hutchins disease. Then Croton's joint, osteitis, and chondritis, which leads to sudden nose, frontal bossing, and sabritipia, and perforated palate. Hutchinson teeth, you can see, are very particular looking. The upper central incisors are widely spaced, centrally notched, and tapered in the manner of screwdriver. The molars may show multiple poorly developed cusps, which leads to the mulberry molars. This you can see a newborn with syphilis. So the congenital syphilis can lead to miscarriage, and it would be second trimester onwards. Then the stillbirths, the prematurity, low birth weight, or death shortly after birth. Up to 40% of babies born to women with untreated syphilis may be stillborn or die from the infection as a newborn. Levels of prevention, primary, secondary, and tertiary. Prevention and control strategies of STDs, sexually transmitted disease, mainly includes the organization of STDs control, primary prevention, school health education, mass media for health promotion and prevention of STDs. Starting with the primary prevention, which occurs at the individual level, societal and community level, and then the policy and the environment. So the health promotion includes the strategic areas, promoting public health policy. Second is promoting a supportive environment. 3 is strengthening community action. 4th is promoting healthy personal behavior skills by providing information education, and counseling. Fifth is orienting health services towards meeting all the patient needs. Specific health education programs regarding safe sex, using condoms, reporting for early treatment, and strict compliance. All these factors prevent further transmission of disease. Specific protection. Syphilis is a unique among sexually transmitted disease in that it remains curable with a single dose of penicillin with no documented risk of resistance. Formulated for this purpose is long-acting benzathine penicillin G. No vaccine is available to prevent syphilis. So the secondary prevention includes early diagnosis and prompt treatment. It includes a syphilis serological assays. These are non-tryponimal assays and then the troponin-specific assays. The first, the non-tryponimal assays are the Journal Venereal Disease Research, VDRL, then Rapid Plasma Regime and Automated Regime Test, ART and RPR. Then after this, there are troponin-specific assays, which are the fluorescent tryponimal antibody absorbed FTA, then microhemagglutination antibody testing, and then the immunoassay. Standard protocol for syphilis screening and diagnosis. First, in the screening, there is not tryponimal testing, which is VDRL or RPR. If the test is negative, then stop over here. But if this test comes positive, then we go towards the specific tryponimal testing. Test comes if negative, then stop. And if it comes positive, then assess for the treatment. So it is the confirmation and then the treatment will start. Treatment of the syphilis is syphilis and then the congenital syphilis. Syphilis can affect your brain and other organs, but this is the good news. It is curable with antibiotics. Primary, secondary, early latent syphilis. The recommended regime is benzathine penicillin G, which is 2.4 million units intramuscular. If a patient is allergic to penicillin, then a doxycycline 100 mg twice daily for 14 days, ceftriaxone or azithromycin can be given. On ceftriaxone, there are limited studies available, and on azithromycin, there is a preliminary data is available. In case of congenital syphilis, it is proven highly probable disease for this aqueous crystalline penicillin G, 1 lakh to 1,50,000 units per kg per day, and administered as 50,000 units per kg doses IV 12 hours during the first 7 days, and there are 8 hours for 10 days. Or procaine penicillin G 50,000 units kg per dose intramuscular in a single daily dose for 10 days. So if we move towards the summary of the syphilis, it is a sexually transmitted disease. It is caused by the Treponema pallidum. It is spirochete. Diagnosis is done on the serological test, and the treatment is penicillin. It has 3 stages: localized, primary is the Shankari's, disseminated, secondary is widespread maculopapular rashes, and the systematic, which is tertiary, leads to the involvement of the various organs. Moving towards the recent updates. Global Health Sector Strategy on Sexually Transmitted Infection 2016-2021 by WHO. And this strategy was based upon the strategy of 2006 to 2015 and set out some goals, targets, guiding principles, and priority actions for ending the sexually transmitted infection epidemic as a public health problem. The global elimination of congenital syphilis. The overarching global goal of present study is the elimination of congenital syphilis as a public health problem. This would achieve through a reduction of prevalence of syphilis in pregnant women and by the prevention of mother-to-child transmission of syphilis. And it has basically, this strategy rests on 4 pillars. Number 1 is ensure sustained political commitment and advocacy, increase access and the quality of maternal and newborn health services, screen and treat pregnant women and their partners, and last, establish surveillance, monitoring, and evaluation systems. Recently, the WHO regarding syphilis, there is a start of the initiative, which is called Triple Elimination Initiative. In this, the elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B. And these are the essential one, and these services include testing for HIV, syphilis, and hepatitis B virus in antenatal care clinics, prompt and efficacious interventions to treat women who set positive and to prevent transmission of the infection to their children, counseling for women and their partner to reduce transmission risk and ensure appropriate treatment, appropriately attendant safe delivery, appropriate follow-up exposed infants, including hepatitis B vaccine birth dose, optimal infant feeding, and lifelong treatment and care for mothers living with HI or eligible for treatment for hepatitis B virus or syphilis. These are the different parameters they are going to touch in this strategy to reduce the syphilis in pregnancy, men who have sex with men and syphilis, sex workers, etc. New data suggests STDs continue to increase during first years of COVID-19 pandemic. The new released data by CDC's reported cases of gonorrhea and primary and secondary syphilis were up to 10%, 7% respectively compared to 2019. Syphilis among newborns, which is congenital syphilis, also increased with reported cases of nearly 15% from 2009 and to 35% from 2016. Early data indicates primary and secondary syphilis and congenital syphilis cases continue to increase in 2021 as well. Reported cases of sexually transmitted disease in the United States decreases during the early months of COVID-19 pandemic in 2020, but most research by the end of that year. Ultimately, reported cases of gonorrhea, syphilis, congenital syphilis surpassed 2019 levels, and there were different factors. Several factors likely contribute to the initial decline in reported STD cases during the first part of 2020, including reduced frequency of in-person healthcare services as routine visit decreases, resulting in less frequent STD screening. Then the diversion of public health staff from STD work to COVID-19 pandemic, STD test and laboratory supply shortages, lapses in health insurance coverage due to unemployment and telemedicine practices that led to some infections not being captured in national data. Syphilis statistics by CDC. Basically, men account for the most cases of syphilis, with the vast majority of those cases occurring among gays, bisexual, and other men who have sex with men. So you can see it is the number of cases, and these are the years. And the main chunk of this syphilis is by the MSMs. Syphilis patients surging in Japan in 2022. This article. In this, Tokyo cases of syphilis surging across Japan, with the number of patients so far this year up to 1.6 times compared to the same period in 2021. A year that saw record high case figures, prompting medical specialists to warn that it has become a common sexually transmitted disease. The infection rate when a person has sex with a syphilis patient is high and around 30%. However, it is thought that patients tend to be unaware they are infected and fail to take tests or undergo treatment, which in turn accelerates the spread of the infection. Congenital syphilis increase in USA. One of the articles in Lancet. The rising congenital syphilis number in USA reflects the reality of the nation's syphilis epidemic and the growing trend of syphilis infection among women and their male sex partners. Syphilis is not the only sexually transmitted disease that is increasing in the USA. According to CDC, there was a nearly 30% increase in chlamydia, gonorrhea, and syphilis between 2015 and 19, with the sharpest increase in case of congenital syphilis, with nearly quadruple during that time period. You can see syphilis in newborns is on the rise in US. Quadruple, you can see the increase in from 2015 to 90 cases of congenital has have nearly quadruple increase in number. In Pakistan. As such, in Pakistan, there is no separate data is available and there is no special program is going regarding syphilis. There's National AIDS Control Program basically in Pakistan, which was started in 1986 in 87. The heterogeneity and interlinkage of high-risk rejecting sexual behavior combined with low levels of HIV knowledge and prevention and high levels of other sexually transmitted infection, the few of the main objectives of National AIDS Control Program are as under, which includes the prevention of HIV transmission, safe blood transfusion, reduction of sexually transmitted diseases transmission, and establishment of the surveillance. Now it's time for the multiple choice questions. Syphilis is a sexually transmitted disease that can cause serious health problems and caused by spirochete. This disease is fungal, bacterial, viral, or parasitic.
B.
B.
The correct answer is B. It's bacterial spirochete. Shankari is a painless ulcer most commonly formed during the primary stage of syphilis, as is found in the throat, chest area, vagina, genitals only, buttocks, back, arm and legs, genitals, anal, rectum, vagina, lips, and in the mouth.
D.
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 Yes. D is the correct answer. Shankari is common in option D is correct. In this state of the antibody test, it is found to be positive in 1 to 3 weeks post the appearance of the Shankari. Tertiary stage, secondary syphilis stage, primary syphilis stage, or latent syphilis stage.
B.
D.
No. The correct answer is primary syphilis. Primary. Shankari is a feature of the primary stage. The correct option. Which of the following stage of syphilis is asymptomatic and not contagious? Primary, secondary, latent, tertiary.
C.
C. C.
C is the correct answer. Latent is the stage which is asymptomatic and it is not contagious and it remains for years. In addition to rashes, oral lesions of secondary syphilis include all except snail track ulcers, mucus patches, Shankari of tongue, or Hutchinson warts.
D.
Delta.
No, when I was telling you about the stages of the syphilis, I have told you the primary stage is called the Shankari stage. Shankari is only present in primary stage. It heals after 3 to 6 weeks. So in the secondary syphilis, Shankari of the tongue is not the correct option. Generalized skin rash, symmetrical distribution of flexural aspects of arm, flanks, and palms, painless, indurated, and pleomorphic in nature, and accompanied by lymphadenopathy, is a characteristic of measles, rubella, chickenpox, smallpox, secondary syphilis.
E. E.
Yes, the characteristic features of the secondary syphilis. Congenital syphilis is a chronic infectious disease acquired by the fetus before birth. Which of the following is not characteristic of congenital syphilis? Bones complex, facial keratitis, mulberry molars, or non-incisors.
A.
Alpha.
Yes, Goons complex is not because there is Hutchinson triad, which includes different features. Goons complex is present in TB, so it's not this feature. Neurosyphilis is a bacterial infection of the brain and spinal cord. It usually occurs in people who had untreated syphilis for many years. General paresis in neurosyphilis is a feature of primary stage of syphilis, latent phase, secondary stage, or tertiary stage.
D.
Delta.
Delta, yes, delta is the correct answer, the tertiary stage of the syphilis. The first consideration in the differential diagnosis of a painless palatal perforation would be syphilis, histoplasmosis, sclerophoderma, and actinomycosis.
A.
Yes, A, because there's the gumma formation, as it is the presentation of the late syphilis. So it could be a painless palatal perforation if there is a gumma formation over there. So A is the correct answer. Syphilis can be diagnosed by testing. Which of the following tests identify the presence of syphilis in the latent period? Urine test, spinal tap, serological test, or saliva culture?
C.
Yes, C is the correct answer, serological test. This is the key and thank you so much.